Bloodless surgery lengthens bones. That could well sound like a line from an ad campaign, but it is not. It is an amazing scientific fact. The method of lengthening bones is known as the ILIZAROV technique, named after Dr. G.A. ILIZAROV. For patients, the world of hospitals is a dismal one. People come with pain and misery, hoping against hope that modern medicine will change their lives. For each patient, his condition is the worst. Who can really say which illness or disease is worse than the other? For those with bone deformities, nothing could be worse. Patients afflicted with distortions of their bones are looked upon as oddities. They've had to live with it, unable to do anything about it. Until recent medical history changed with the dedicated research and successful experiments of a Russian doctor, Dr. G.A. ILIZAROV. In 1945, Dr. ILIZAROV was faced with a deluge of crippled World War veterans. His helplessness was combined with the basic ineffectiveness of conventional methods of repairing bones. That was the beginning of a long journey of research into the behavior of bones, which led to the invention of a device that could straighten and lengthen bones. When this technique was accepted by the world community of medicine, Dr. ILIZAROV came to be known as the Michelangelo of orthopedics. With the help of hospitals and doctors in 60 countries, more than 30 lakh patients with bone deformities have benefited from the ILIZAROV technique. India is one of the countries where this technique is available. Apollo Hospital, one of the premier medical institutions of India, is successfully curing patients with bone deformities for the past 9 years.
By ILIZAROV technique, we are simply elongating by natural process, natural cell division and natural regeneration of the contacted tissue. So the whole thing becomes anatomically normal in a natural process. So the flexibility and suppleness of the tissue remains as in the natural form. So patient can utilize that limb in the similar form that as the normal limb.
The ILIZAROV technique is not an invasive surgical method of treatment. In fact, a patient can walk out of the hospital on the second day, and the process can be continued within the comforting surroundings of home. But since the technique is not widely known, patients and their relatives have to be counseled and informed about it in detail. In most cases, people come hoping against hope. It is impossible for Mr. and Mrs. Gupta to believe that their son, Nikunj, afflicted with a bone deformity, could ever have straight legs to walk on. But soon, the parents are convinced that a supposed miracle is possible. Only surgeons and doctors do not call this a miracle, but a technique based on a researched and proven scientific system. It is estimated that more than 800 orthopedic deformities can be cured by the ILIZAROV technique. Once patients and relatives are convinced, the path for change begins. Precision in understanding the case is critical at this juncture. A complex set of tests need to be done. Only then can the surgeon really know the specific structural problem of the patient's bones and decide on the exact procedure for the cure. The doctor then tries to explain the intricacies of the technique. For centuries, surgeons believed that bones have a low regenerative power and low plasticity. But Dr. ILIZAROV's research showed otherwise, that in fact, bone is a living tissue capable of rapidly regenerating and growing. It was proved that in this process of regeneration, the bones revert to the embryonic stage as when a fetus is in the mother's womb. The ILIZAROV technique functions on the basis of this fundamental aspect of regeneration. In this technique, the bone fragments are first brought closer together with the help of a device. This bringing together allows for new bone tissue to form. Then, the rings are moved apart millimeter by millimeter at regular intervals, allowing new formation of the bone to take place. The bone formation is also accompanied by growth of the connected muscle, nerve, skin, and blood vessel tissue. The process of elongating the bone is continued till the bone grows to the required length, which could be up to even 50 centimeters. The entire ILIZAROV procedure is done with a set of rings which are linked by rods with straps at their ends. The rings can be brought closer or moved apart by using the straps. Today, there are a number of surgeons in the world who testify to the efficacy of this device in successfully lengthening and straightening bones.
Success rate of this technique is 100%. You decide your aim preoperatively, it gives 100% result. Second thing, you can anytime modify the frame. If you are not getting the desired result, you can modify the frame by applying different hinges, different distraction rods, telescopic rods, and you can gain the desired goal. The major drawback of this technique is you can't gain the muscle power back. If muscle power is lost, that can't be regained. Otherwise, you can correct the deformities. You can gain the 100% length like normal limb.
The process of fixing this device is termed as an operation only for want of a better word. In fact, in this method, no scalpel is used, almost no blood spilt. There are no stitches, no chances of infection, which occur after major surgeries. The only sign of this unusual surgical intervention are the puncture holes. There are other advantages too. The patient does not have to be confined to the hospital bed. In fact, a patient can be discharged after 24 hours. This not only reduces the trauma for the patients and their attendants, it also cuts down on the overall costs of recuperation in a hospital.
After the operation has been done, we start the physiotherapy right from the day one with some kind of exercises so that there is not much pain, there is not much swelling, there is not, patient gets more confidence also. And meanwhile, when the process takes about roughly 3 to 4 months. And during these 3 to 4 months, when we are lengthening the bones, rather the length, the muscles, the veins, the arteries, the nerves, all underlying tissues, they also start getting shortening because we are lengthening. So in order to cope up with the lengthening process, we have to stretch all these subcutaneous tissues and all these items so that this also goes on along with the lengthening.
Physiotherapy is an important aspect of the ILIZAROV cure. It requires complete dedication from the patient. The growth pattern of the bone and rejuvenation of muscle and tissue can be affected without proper physiotherapy. Specific exercises have to be undertaken so that a patient can really walk straight one day, an event that Mohit or his parents may never have believed possible before. It is estimated that there are about 10 million orthopedically handicapped people in India. Obviously, the ILIZAROV technique can bring a spring in the steps of many of them.